besties, I have happy news again. Yeah, we're having good luck with doctor's appointments lately. I'm loving it. So today I saw my primary for my follow-up with my hip x-ray. And so, my hip x-ray was good in the sense of like there's nothing like anatomy-wise wrong with my hip, and there's no arthritis in my hip. So that's cool. Which means he feels it is a ligament thing. And that my ligaments in there are just way too tight and just holding it in a place where it doesn't have the mobility it's supposed to have. And so, I finally got my referral to physical therapy, y'all. I have been trying to get physical therapy this entire time. Like, and what I mean by this entire time is I have been trying to get physical therapy since I found out I had POTS the first time, back in 2020. So I am so excited! And the physical therapy place is literally like 6 minutes from my house. It is right here. Because all my appointments I drive. My father-in-law drives me. Like 20 to 25 minutes-ish. And then one of my doctors is in Southern Pines. Which is like 50 minutes-ish. 50 minutes. I can tell if I said 15 or 50 minutes. So this one being like literally by the house is awesome. I'm so excited. And so right now we're going to start with probably every other week, and then he said it depends on what they want to do, yada yada. Oh, my cat is here now. It's my cat's birthday today, by the way. She turned 6 today. So, oh, are you going to make your presence known? Yeah. I'm letting this happen because it's her birthday. We are not redoing the take. It's the mama's birthday. She had the best time. I will insert pictures of her enjoying her birthday presents. She had the best time. She has never been this happy about toys ever. So, but anyway. So he said it'll probably be an every other week thing for now, unless they want to move it up to every week. If they do every week, though, I need to get cleared to at least drive short distances, because I'm not doing that to everybody. I'm not relying on everybody to get me there every single week when I also am having weekly appointments with other doctors farther. I would rather it just be, okay, I handle the little 6-minute drive where it's literally like down 2 roads, and then if it's any farther than that little area, then, you know, we divide and conquer. Because that's crazy. Like, that's a lot on them. Because, like, obviously my in-laws work, so. But anywho. And then he said that they'll come up with a regimen for me. So, we went over more of, like, how long my pain has been going on, and what other joints are in pain, and all that good stuff. Because he was like, you're sure you have not had a sports injury? Like, he still is just so on that topic, because my hip is acting like I have. And I was like, well, I talked to my mom about everything, and she said that when I was a baby, they used to, like, hold my little feet and do this bicycle motion to get my hips to rotate. Which is literally what he did with me to see what it was doing. I mean, other things as well, but that was one of, like, the movements, was moving my hip in the same rotational direction. He just held my calf instead of my foot. And that my doctor was concerned then about my hip, and just it never got investigated because he was concerned about it because I wasn't walking when I should have. But also I'm autistic, so it's like, could be any of those things. But you know, autism and EDS go together. But anyway, that's a common link that people are learning now. But anywho, and so once I started walking, they dropped the subject. And then it didn't come up again until middle school because I kept hurting. I'm saying hurting because it just hurt, but I didn't do anything to it. I kept hurting my knee. And wanting a knee brace. And my parents were kind of like, well, like, you know, you don't work out a lot, whatever. And like my gym teachers were like, you're just not fit. And I was like, okay, like maybe it's just I need to work it out more. Maybe that knee is just weak and I need to get it stronger. And that's all kind of what we thought, because my gym teachers were just jerks, and my parents just have never dealt with this before. Like, I'm not upset, but, and then fast forward to when I'm in dance in high school on the dance team, I just could not keep up with my dance team. at all. I could not, my body literally would not do the things. And so my dance teacher was convinced that when I told her I was practicing at home that I wasn't. And I was like, no, I am. Like, I promise you, I'm just not flexible on that side of my body and I don't know why. And like, you know, my best friend was in cheer and she can only do her splits on her one side and whatever. So I was just like, you know, and I explained all of this to him. I gave him, like, everything I'm saying right now, I said to him. And he was like, okay, so I understand, like, what you're thinking and where you're coming from. But letting you know, especially, like, your gym teachers and stuff, should have noticed this because that's not right. And them pushing it is why it's this bad now. And he was like, your hip was neglected. This whole situation was neglected. So we're going to get you in physical therapy now, but I'm being totally honest with you, you're going to be in physical therapy for a very long time. Because this is 21 years of immobility that we're trying to fight when it really should have been being worked on when you were very little. Or at the very least by middle school. And I was like, yep. That sounds good to me. That makes sense. That tracks. And so then he just explained to me how physical therapy works, which I understand it. My dad was in physical therapy, so I get the process that, you know, they show me things and there's things I have to do at home and keep up with it and whatever. So you guys are gonna start getting little, like, physical therapy check-ins and shit. I'm so excited. I'm so excited. Because also, with me being autistic, I thrive off of direct instruction and direct schedules. And so every time I've just been told, like, oh, you know, exercising is helpful for your POTS, and there's, like, the CHOP protocol, and I'm in a Facebook group for it and everything. And then, like, you know, I was trying to walk with my father-in-law, but I was having the migraines in the morning, and then, honest to God, like, my hips have been bugging me and whatever. So, you know, I couldn't keep up with that, and that just hasn't been working for me, especially with my fatigue and stuff. But it's just us been picking and choosing things kind of aimlessly. So now I'm going to be given, like, literally what I'm supposed to do. And I'm able to then tell my PT too, like, because he told me I need to make sure that they understand I have POTS. And he said to make sure to tell them that how long this issue's been going on, because it does change how we go about it. Because instead of rehabilitating somebody with a sports injury, we're trying to get the ability to begin with because it never was there. So it's two different, like, attack plans, I guess you could say. But he said that the reason I'm having pain in my left knee and my right hip, because my right hip clicks, is because they have compensated for this hip, and my pelvis is literally tilted, leaning into my right hip. And then my body weight is what's sinking into my left knee. So, he said that's why it clicks. And I noticed, just because, like, you know, put it in my head to be thinking about it and to be cautious about it after my x-ray, I noticed if I do try to lean into this left hip, then my right hip's not clicking. So, that makes perfect sense. Like, he's so smart, dude. Like, every single thing that he said today was light bulb moments of, like, oh my god. Like, yes, that's exactly what I've been dealing with. Because he was like, does it have pain? And I was like, not necessarily. But when I do, and he was like, so yes. He cut me off. He's like, so yes. And I was like, well, it's not constant. He's like, that doesn't matter. Does it ever hurt? And I was like, yes. And he was like, okay, now say when. And because I've gotten stuck on the ground twice. And then after my x-ray, after I had to do, like, the froggy position, I couldn't straighten it back out. And I manually straightened it back out. And he filled in the blanks of that sentence before I even said it. And he knew exactly what I did. And he was like, okay, yeah, this is a problem. So, and he was like, we can do an MRI of it if it comes to it where, like, PT's really not doing anything for you, to try to look into that further. But he's like, I really think PT is the right step. And that the MRI might be a little bit of overkill right now with everything else I'm having done, especially because I'm trying to even get an MRI of my brain. And that's already booked super far out. So I'm fine with that. But yeah, I'm so excited. Like, this is literally what I've been waiting for. I'm so freaking happy. So, happy news! Hi, besties. We are having a business meeting right now. I had a very big appointment today. A very big appointment. That this might actually be 2 videos, we'll see. Or at least I will answer questions. Also, ignore my skin. I'm having a very bad skin day today, which is part of why I had a big appointment. I saw an allergist today. And I saw a very, very good allergist today. I have never had this good of an experience with an allergist. So, my husband had seen one because he has chronic urticaria, also known as angioedema. And, I'm not gonna lie, I hated who he saw. I really did. She brushed off everything he's going through. And now the treatment plan that I got put on, I have a lot to tell my husband. Let's put it that way, because he has the same thing. I have other things on top of it, but we both have this. And then the other girl that I saw, I did enjoy. I'm not gonna lie, I did really like her. She did get me a lot farther in the journey than I had been previously. However, her knowledge of things was limited. This guy took what she started and ran to the finish line with it, baby, because I have so many options now. So, I got diagnosed with a lot today. Number 1, chronic urticaria, also known as angioedema, which is chronic hives. We already knew that. All my hot spots. I have so many pictures. I got a lot of advice from the chronic illness girlies that I follow here on TikTok to take pictures for my allergist, and I did. That's what got me diagnosed today. So, thank you guys for that advice, because I wasn't in an active reaction when I was there. I am now. Wasn't while I was there. So, I have chronic hives, and that's what the paper is, and he gave me so much information. So much. And then he also gave me all of these resources as well. It's all different QR codes I can scan, and he circled the ones that apply to me. I also got told right out that I very likely do have MCAS, which we've been new. His thing, which I respect this opinion so much, because at first I was like, oh no, but then when he finished the explanation, it made sense. MCAS is a very controversial diagnosis in the allergy community right now. And it's not for what you think, because that sentence pissed me off too, because they've said that about my POTS when I have it. What he means by that is a lot of doctors will now throw that label at people that have something autoimmune happening. So he wants to test me for more than the basic autoimmune, because I've been tested for lupus and rheumatoid arthritis and a couple other ones, the super common ones. I mean, they're still not common, but you know what I mean. And I don't have them. There's more he wants to run. And then, if I do not have autoimmune, then he is comfortable referring to it as MCAS. And he even gave me resources on MCAS. But he wants to be sure. So, I liked that answer a lot. I love that answer a lot. So I have to go to Quest Diagnostics, and he ordered, number 1, we're testing my tryptase again to get a baseline, and then we're going to try to get my tryptase when I'm in an allergic reaction, because he understood that. My other allergist did not. She just kind of was like, well, if you're not in an active reaction, then your tryptase is going to be off, so this isn't really helpful. He was like, no, so we just test you while you're in a reaction. Like, he, took that knowledge a little further. And, the one test, I don't want to show everything, because it's going to show, too much info about me. But, hold on, I'm folding it. This whole thing is a part of the blood test. And then, this is all the blood tests that he wants to run. Testing for autoimmune. He wants a blood allergen panel because my scratch test was over a year ago. And then he wants my tryptase again. So that's that. And then, treatment plans for things. Well, also, we tested my asthma again. Do y'all remember when I had to fight for an asthma test? And it was hell to get? And then I got no answers after it. I was just handed an albuterol inhaler that I can't use with my POTS. Yeah, all I had to do was say, hey, I was evaluated for asthma. And he was like, okay, that was a year ago. Let's do it again. And then they just did it. My lung age is 52 years old. My lungs function like I am a 52-year-old person right now. They don't inhale enough air, so then I can't exhale properly. So he does think it is asthma. But he does not think I have COPD. So, that's cool. So, my numbers are does this say anything super important? A little bit. I will do it this way so you don't see the stuff at the top. My little charty thingy is crazy. Sorry. So, we have a plan. And this is a plan that I've heard circulate in the MCAS community. So, I am very excited about this plan. First of all, I'm staying on my montelukast. We love her. We love her. She is why my asthma has not gotten bad until now. I've been on montelukast since I was 6. So we love her. She's staying in the family. Next, I am on Zyrtec. However, I take 1 Zyrtec in the morning and that's it. So actually, and this is wrote out, so I'm going to read it to y'all because it's cool to have it written like this. Antihistamines are the most safe and effective medication class. Studies show that they can be used up to 4 times the dose used for allergies. This is considered off-label, but is supported by research and clinical guidelines. Antihistamines may cause drowsiness at higher doses. If you have hives that are infrequent, these medications can be used as needed, which is what my husband's is. However, now his are frequent, but they weren't. And then, if they occur more frequently, mine are daily, then they should be used every day to decrease how often and severe your episodes occur. He wants me starting where I'm going to take Zyrtec once in the morning and once at night, and we're going to eventually get me up to twice per day. And he said that I would never have somebody do something that I wouldn't trust on my own family, and he explained that his daughter, that has had severe allergies since she was 5, did the twice a day since she was 5. And she is now older. So, I'm so excited. And then, it is still safe to take Benadryl for breakthrough reactions on top of that. That I did not know. Because, like, I'm having a breakthrough reaction right now, but we didn't start the new thing yet, and I took my medicine late. I'm not counting it today. But, I will wait to take it until I've had my Zyrtec in my system for at least 12 hours, and then I will take Benadryl. And then I won't take anything that night because I took my night Benadryl early. So now I can just take it. So that's the allergy stuff. And then he said if I'm having a lot of my GERD reactions and they seem to be lining up with my allergic reactions, I can also add Pepcid into the mix. And I can take it up to twice daily. He said that's up to me if I want to do that. He's not going to force me to do that because I have been on Pepcid before, but that was when I was in high school and not on any antihistamine. I was only on the montelukast, so I just thought that it didn't work, but maybe in conjunction it will. Because it's also an antihistamine, just a different class. So I'm allowed to take Pepcid on top of all of this, which I've heard a lot of my MCAS girlies do. So I am so optimistic and excited. And then again, this whole sheet's resources and stuff. And then, for my asthma, we are going to start me on Flovent, 2 puffs a day, which is a controller inhaler. I didn't even know that was an option. And now that's what we're going to do because my levolbuterol does not consistently work. So it can. It depends on what kind of attack I'm having. So he feels the controller one is going to fix that. We're having trouble getting my insurance to cover it right now, but he said that he just has to do the pre-authorization. The reason I'm doing Flovent and not Advair is because Flovent is safer for people that have heart conditions like me. Well, POTS is a nervous system condition that causes tachycardia, and I also have PVCs and PACs. So, Flovent. Same reason why I'm on levolbuterol, not albuterol. Albuterol is also harder on the heart. And he's also starting me on the lowest dose of Flovent as well. So, and then again, this whole thing is info and resources and plans and all that good stuff. So, dude, I am so excited. And, like, this isn't even all of it. Like, he wants to check my lungs again after the controller inhaler. And he wrote out a goal list for what we're trying to get going here. And, like, he's on top of it. He was so awesome. He's so awesome. And just so educated. And, like, I feel like I'm in good hands. Like, I'm so excited. And because I think my MCAS is or whatever this is. I'm just going to keep saying MCAS until that diagnosis changes. If it changes. And I obviously will update, but right now it's MCAS that's what I'm comfortable with explaining it as. Because that's what it's been explained as for the past 2 years. Anyway. I feel like I'm in good hands with my MCAS. Because I was going in there, like, told that there was no other options besides the Zyrtec that I'm on. And, like, yeah, I know of people that do Chronically, but I thought, like, I was going to have to jump to that right away. And I'm still not opposed to it, but, there's so many more options. Especially because my MCAS does not present as severe as a lot of people that I know. So, I'm so excited, dude. I'm so excited. And, like, he was just so respectful, and he immediately was like, we are going to do this, and this, because I want you feeling better in the next 3 months. I was like, so much luck with good doctors, yay! Hi, besties. I want to talk about asthma while I'm putting away dishes, because I'm learning things, and I currently was just in an asthma attack, and I didn't know. Not like a hospitalization one, like I just needed my inhaler. And we're giving it its time to see if I need a second puff or not, but I'm already feeling better. So, I didn't know what my asthma attacks were, and my allergist gave me all these resources to start looking into and reading and whatever about asthma, because nobody's explained it to me before. I just got told, yeah, your lung function's not great, you have asthma, here's albuterol, go home, right? use your inhaler when you can't breathe. Yeah, so here's what's funny. I don't wheeze, and I can still breathe. We are so far thinking I have the inflammation type of asthma where my lungs just get inflamed. They don't actually constrict, which means air is getting through. However, it just really hurts, and it gets really tight. Like my, literal chest, here, and, my back gets tight, but they're not, where I'm wheezing. I'm not having that part. I also don't consistently have the cough for it. However, I have GERD, and I didn't realize that GERD and asthma go hand in hand. So, I'm learning that. I did not know they go together, and they do. And then, anyway, so I was told, when you feel like you can't breathe, use your inhaler. So that's what I would do. So I've only actually used my inhaler, 4 times, in the past year. Before that, I used it every time I knew I was going to exercise or be around a fire or fireworks, so I was using it technically correctly then. But, if I would just have chest pain, I was like, oh, well, I have POTS, and POTS causes air hunger and causes chest pain, and, well, I have anxiety, and if I get worked up, it causes chest pain. Those are my asthma triggers. It's my asthma doing that. And I didn't know that I was supposed to be using my albuterol, and now I'm on levoalbuterol because albuterol is not safe for POTS, for most POTS patients, depends on the cause of your POTS or whatever. Or the symptoms you personally have with your POTS. For me, it's not safe. So I'm on levoalbuterol, which also known as Xolair, which has a, or not Xolair, Xopenex. There we go. I have names jumbling in my head right now. Xolair is the other thing that I might end up on. Xopenex, which is safer for people that, experience tachycardia, because it has a lower chance of it than everything else, right? Yeah, I'm supposed to use that every time I have chest pain. Because my asthma attacks are chest pain. And so, if we're going off of that, I have 2 to 4 asthma attacks a week. And what I'm saying as asthma attacks is I'm calling those asthma days because it'll just come and go all day. Because I never did anything about it. So I don't know if those are individual attacks or not. I'm gonna hope they're not, otherwise I have more. But yeah, so I've been doing things completely incorrect this entire time. The other thing is I found out I used my inhaler wrong, and I guess that's really common. I was doing a couple big errors that was diluting the shit out of the medicine in my body. First thing is you are supposed to do a big inhale and then a really big exhale. If you've had the asthma test before, you are supposed to, how you exhale for that, you're supposed to exhale like that for your inhaler before you use it. I didn't know that. I was just going and then using my inhaler. No, it needs to be so much bigger than that. Because you want your lungs completely empty before you inhale your inhaler. So that's the first mistake I was making. Second mistake is I would press the button and inhale at the same time. They actually want you to start the inhale before you press the button. Otherwise, it might sit in your mouth for a couple seconds before you're inhaling, and the speed that it's going, it needs to have kind of like a head start. Otherwise, it just hits the back of your throat. The other thing is that I guess it's way better to just be using a spacer, period, because it will still just hit the back of your throat. And the positioning of, your head and stuff matters, too. Which I didn't know. Also, I'm sorry if you can hear that ad playing on my TV. It's so much louder than the video I was watching. So, doing that wrong. I'm gonna order a spacer if I can't get one sent to me. Or prescribed to me, to have at home. I'm gonna be totally honest, I'm not gonna keep a spacer with me. It's not gonna go well for me. However, because I'm on levoalbuterol, that's a bigger inhaler anyway, and it doesn't, I hit the button of it in my purse all the time and stuff. I gotta figure out something better for that too. So adding a spacer to that mix, I'm gonna be totally honest with you, it's not gonna happen. But I will have one for at home, because to be fair, my asthma attacks happen way more often at home. So, I think, now I'm, looking back at every asthma attack I've ever had ever and realizing how often I was having them, so I don't really know. But yeah, those are all the things that I learned so far. Oh, and then I do hold my breath correctly afterward. I hold it for long enough, so that's good. I at least do that part right. And then, yeah, I think that's everything. Oh, I'm not cleaning my inhaler enough. I didn't know if it sits, like, at all, you should be rinsing the housing out, and then repriming it. I didn't know that. So, the times that I've used it, besides the day it came out of the box and I primed it, I haven't been taking full doses either. Which, that's part of the instructions, is to prime it, but I didn't understand the cleaning part. I didn't know what it meant by that. So, I've also been doing that wrong. And so I'm very thankful for this new allergist that actually explained everything to me, because now I'm gonna do the right things. And using the inhaler this time for this asthma tech felt completely different, because I told him right out, I'm like, my levoalbuterol doesn't work. Which, either way, I need to be on the steroid inhaler that he's putting me on, because I have persistent symptoms anyway. You're still not supposed to rely on your rescue inhaler, but that was the thing, is I couldn't rely on my rescue inhaler because I wasn't doing it right. So, learned so many things. Hi, besties. You want to hear about this crazy PT appointment that I had yesterday? Because, girl, I learned a lot. So, if y'all didn't know, I have suspected hypermobile Ehlers-Danlos syndrome. HSD has been thrown around for me, but, like, the current research is saying that there's a chance they're actually the same thing, just varying degrees on the spectrum of hypermobility and everything. It's just, like, depends on, like, how much pain and how much it's, like, impacting your life. Which, like, tracks. But I've been trying to get diagnosed for the past 4 years. Or when I say trying to get diagnosed, I mean trying to be even just properly evaluated. I have had 3 different primary doctors think that I have HEDS, and then I will get referred to rheumatology, and either they just won't return my call, or they will, and then say, yeah, like, you know, we talked to your doctor and read over the referral, and it does sound like you have HEDS, however, we don't treat that here, and then they won't see me. And that's where that's gone. So I still have not been evaluated for HEDS. However, per the diagnostic criteria of 2017 that is on, like, the Ehlers-Danlos website, I do have it. So, that's where it's been at. So we've just been doing, like, the lifestyle changes that we can to help it in case that is what it is, and then that's just kind of been where it's at. And I have vascular EDS ruled out. That's the only one that's ruled out because of I get heart scans and everything all the time of my vascular system and everything. And I haven't been able to get into a geneticist either. Well, now I have a new primary, and my new primary was like, well, let's rule out all of the easy things. And what I mean by easy is easy to diagnose, and then go from there. Well, so far we've been ruling out each easy thing. And, like, he didn't say no to HEDS, but he was like, you know, that is a rarer condition, so we need to have everything else ruled out, which I understand, but he's not saying no. Well, then he was looking at my mobility and saw that I have hypermobility in my shoulders and this hip, and that this hip is, like, immobile. So he referred me to physical therapy for this hip to get this hip stable again, right? Well, I was in PT yesterday, right? And she has me doing a thing, because she agrees that my this hip is hypermobile and my ankles are hypermobile, and so are my knees. She agrees on that. She thinks that's part of the problem, and so she said, right out, we're going to stabilize the muscles around those joints to help combat that, because that's why this hip's not working right. This hip isn't engaging because everything else around it's hyperextending, so, and they're kind of, like, compensating for each other. So, anyway, but that's all she's looked at, is from hips down, right? Well, she has me do this thing where you lay on your stomach, and then you put your arms up straight, you know, like stretching like a cat, right? But then, while I'm stretched out, she then has me going down and do a push-up, having my chest touch the bench that she has me do everything on, and then push myself back up. So my, like, hips are staying on the bench, which is why this is helpful for your hips, because it's making me flex in this direction, right? Every single time I did it, my shoulder was popping. And I felt it full leaving the socket. So, and this shoulder, I have to pop back in every morning. But again, like, I know that I'm hypermobile, so it's just kind of been one of those things, right? So I was like, hey, is my shoulder supposed to do this when I do this? I already knew the answer, and she was like, no, let me see. So she goes to the shoulder, puts one hand here, puts one hand on the back, but, like, flat. You know, I can't do it for myself. And then has me continue the movement, and she follows me down so she can feel when it's popping. And she just kind of, like, looked at me. I was like, do it again. Have me do it a couple times. She was like, is this causing you pain? And I was like, no, but I'll feel it tomorrow, which by the way, that's how I remember to make the video. It hurts. And she was like, you know, you've been pointing out a lot of your dislocations to me. And it sounds like you're having more dislocations than you realized you were having because they're easy to put back in. Because I kept saying that my stuff subluxes, which it also does, but that, she was like, that felt like more of a full dislocation. And then it was just slingshotting itself back in. When I would straighten back out, it was pushing it back into place. So it was just like leaving place, back into place. We figured out if I put my arms farther apart, it doesn't pop all the way out. It still pops though, just not all the way out. So we continued the exercise like that because then it's just what my hip does, where the ligament's slipping. Because we need to strengthen around it. But anyway, she was like, you know, have you been evaluated for hypermobility, like, officially by a rheumatologist? And I was like, no, like, and then I told her everything, and she was like, okay, because, like, the reason I'm asking is because, like, they think I have HEDS. Like, they think I at least have hypermobility spectrum disorder. And she's like, that's kind of why, like, I understand what I understand for physical therapy. And then we were going back and forth about, she's asking me about me having MCAS and POTS, and, like, a lot of our health stuff's similar. She has a lot more of the gastro symptoms than I do, but I do still have GERD, so, but her journey started with going in for the gastro part of it. My journey started kind of with actually going in for the GERD, but then POTS, so, and we were talking about, like, medical gaslighting and everything. Like, I was like, no wonder I vibed with this PT so well. But I was like, do you think that, like, it's fair to say that I possibly have HEDS? And she's like, oh, yeah. So, she was like, you need to bring that up to your primary now, because it sounds like this guy's a lot more understanding of things, and just see if he'll refer you to rheumatology. So, and maybe he can refer me to somewhere better than the one that I got referred to out here before. Because I think it was literally called, like, Carolina Rheumatology or something, and, like, they just never answered a single phone call, and, like, I never even got to schedule anything with them. The farthest we got is one time they called me, asked for my insurance info, and then never called me again, even though they take TRICARE. So that's not why they never called me again. They just never scheduled me. But there's a lot of rheumatologists around here, not just there. So it's going to be a challenge trying to find one that'll treat HEDS, though. But then I finally got a rheumatology referral again in Illinois, and then called the place, and then they were like, yeah, we don't treat for that here. We don't know what to do with that. We know how to evaluate for it, and that's it. Which is like, okay, can you at least evaluate me so I have the fucking answer, and then I'll take it to somebody else? But whatever. And then she was saying, my physical therapist was saying, she's like, a lot of doctors won't even diagnose HEDS because there's no cure for it, so they don't see the point. And she was like, but, you know, physical therapy helps HEDS a lot. It's not going to fix everything for you. You're hypermobile, but it's going to at least lower your pain levels a bit and help you move more consistently and move in a better way that's less likely to cause more injury. And so she was like, we're going to focus more on this hypermobility thing in other areas as well, instead of just your hip. Because she was noticing when she was evaluating me, she was like, you have more going on than just that hip. But I'm like, yeah, but that hip is the obvious thing. That's why I got sent for that hip. Because that was the first time a doctor was like, hey, that doesn't move right. When we've been new. I've had hip and knee problems my entire fucking life, but nobody's, like, done anything about it, so. But yeah, I feel very validated right now, and just feel like I'm, like, just that next step closer to getting answers, which is awesome. So, suspected HEDS is probably a lot more likely than we thought it was. But yeah, like, that was a really good appointment. Also, it was a fucking workout. I am so sore and tired today. And I was drenched in sweat when I left. Like, I felt really bad. Really bad about it. I felt good. Like, my POTS actually did fine, which was cool. My POTS is doing well with PT. Like, knock on wood, I don't jinx that, but, like, my POTS is enjoying PT. So, like, yeah, I get a little dizzy, but, like, nothing compared to, like, when I was going on walks and stuff. So, like, it's pretty cool. But yeah, so, might have HEDS, might have, like, almost for sure have HEDS, which, like, again, what we thought, but we're one step closer. So, if y'all didn't know, I have suspected hypermobile Ehlers-Danlos syndrome. Hi, besties! Okay, so I just had PT again. I know I posted that video on the 14th, but really that happened on Monday. And now today is the 14th, and I went to PT again. And so I talked to her more about it. Because we are realizing that there is more, even more, that is hypermobile. Today we learned that my knees hyperextend backward. Which, that one I did know, but then I was like, am I just gaslighting myself into thinking that it's actually, like, hypermobile, and it actually isn't? Oh, no, it is. So, she had me on, like, this squat press machine, where it, like, helps you do squats without, like, you just doing them standing. So, you lay on your back, and your feet are on the thing, and then you do your squats or whatever. But today she had me do it where one foot was on the surface and then one was on a block, and so you were doing like an uneven squat. In reality, it's just making you do a one-leg squat where it's putting all your weight into one side, and then we switch. When we were doing that, whatever knee wasn't the one on the block was hyperextending backward when I'm straight now. So and, like, I was like, okay, so I realized I see my primary on Monday. I didn't realize how soon that appointment is. I thought it was later because I didn't realize how far into November we are already. And I was like, do I bring this up to him? And if so, how? And she was like, I would make a list of everything that's hyperextending on you that we've talked about and go from there. And I was like, cool, because, number one, my fingers hyperextend. All of them. All of them go way farther than they're supposed to. This hand, not so much, but this hand has pain that's stopping it. But in reality, it can bend too. And then one side, if I'm not in pain, this side. I can get my thumb to touch my wrist. I know you can't see it because sleeves. This side is, this wrist has pain, so I can't do it. I cannot put my hands flat on the floor like you're supposed to with HEDS because my back stops me because of the pain. So I have the mobility for it, and I did as a kid, but now that all those joints have pain, my body stops it. Like, you know how the, like, human jaw is, like, strong enough to, like, bite through your finger if you wanted to, but, like, our brain knows to stop it from doing that, and so it won't let you bite all the way through? Yeah. My body just does that with my pain, where if it feels pain, it's not going to let me continue that movement, because then things are going to dislocate. But we learned, as I explained last video, that my shoulder is, not sublexing, it's dislocating. And then I rolled my ankle yesterday. And so we went over that, and she was like, so your ankles are for sure hypermobile too. And it's the ankle that she's heard pop on me before. So yesterday, I was moving bins around my house. I will show you more later, but these bins that are behind me were over there. And so I was tilting them up onto a towel and then sliding them across the room because I'm still not supposed to lift until Friday. Even though I feel good enough to, but, you know, don't want to rip any incisions. So I just slid them. Well, when I was doing that, and I was transferring one to be slid, I stepped wrong, and my ankle rolled onto itself. It rolled inward. So I basically stepped onto my ankle, and I twinged the underneath of my foot. I don't think I sprained it. There's no swelling. I can still put weight on it and everything, so I think it's okay. We did PT with caution today, but it did fine. It's just sore, so I think I just twinged it. Fingers crossed I just twinged it, otherwise I see my primary on Monday, and then I can, if he wants me to go get it looked at, but I think it's okay. But that shit happens to me all the time, and this topic of conversation coming up is making me realize just how often I, like, roll things and dislocate things, because, so when I brought up before to my primary that I thought I had HEDS and that I've had multiple doctors think that I have it, he was like, well, you played sports. Have you had any official dislocations? And I was like, no, which is not true. Not true. But I said no. And then I go to PT and she's like, no, you are having dislocations. Those are dislocations. You also have subluxations, yes, but you are also having dislocations. My shoulder being one of them. It's just popping back in when I'm correcting the movement. That's still dislocating, though. It's just I'm naturally correcting it. Versus subluxation, it just pops in and out really quickly. It's different. They feel two totally different sensations for me, too. But in middle school, we were playing basketball, and my friend, I always said it was because of the angle. Now I don't think so. She passed a basketball to me. And so, if y'all didn't know, I don't play basketball. I did volleyball and dance. But They were teaching us to pass like this, right? Like where you push out. And then you receive it in a similar hand shape, right? Well, the ball, she passes it like that. She's shorter than me, which at the time I was 4'11". She was like 4'9". She passes it to me. It bounces. When I received it, how my hands do this, yeah, it did that. My finger dislocated. I didn't know it dislocated. So, I went through half of my school day with it like that until my teacher saw how swollen it got and how I couldn't bend it anymore. And, like, when that happened at first, it was just, like, trigger warning on that if that grosses you out. But, it was just dangling. It was doing its own thing, and I pushed it back in place. But that was second nature to me because my shit always did that. But that's not normal, but I thought it was normal because I was always like that, and so is my mom, which HEDS is genetic. My mom's never seen a doctor for it, but she probably has HEDS too. So that's my connection to it. Connection, it's a connective tissue disorder. But yeah, and now both middle fingers pop, but one of them was the one that broke. I think it was this one. I don't even know anymore. No, I think it was this one. I'm trying to remember if I had to write with it broke. I think I did. But, yeah, and then I went in, and my doctor was like, oh, yeah, you probably did break it, and then put it in a splint. But I didn't have good enough insurance to get it x-rayed or anything, so we just put a splint on it, and it healed. I don't know if you can see that middle finger's crooked. It leans into the other one. That's how I checked to know it was this one. So, it just didn't heal straight. But anyway, what I'm getting at is I've actually dislocated shit. And I have had a sports injury. It just wasn't in the sport that I played normally. I did dance and I was in volleyball, and I never hurt myself in those because of what part of your body you're engaging. However, the only pain that I had in volleyball, which this has nothing to do with HEDS, but my wrists are really skinny. And they still are, even though I've gained 40 pounds on my wrist side, it's never changed. So when you're bumping the ball, it's hitting here. I would have bruises all up this, and it hurts so freaking bad. And when I would practice at home, I had softer volleyballs because I couldn't handle it, but like at school, it just depended on what school had what. But anyway, I'm learning a lot. And then we're realizing that my hip that is hypermobile is turning inward when I do anything. So that's part of why it's hurting and why it's subluxing when I walk, because it's tilting inward and then my weight's going on the outside of my hip and it's kind of going like, and so that's like a whole part of the problem. Because she had me do where like you step up on the stairs and step back down, but she had me doing it sideways and stepping down from the side, and anytime that we were relying on the hypermobile hip, it was twisting. So yeah, she was like, I really want you evaluated for HEDS, or at least for HSD, but, you know, as I said previous video, it's suspected now that those are the same condition, just on a spectrum, which she was explaining to me today, the spectrum of it all. And she was like, you're not going to have every single thing on that sheet, and a lot of doctors misunderstand that. You're just going to have most of it, and that's why it's that, but she was like, the best way for it to go and how your doctor's probably going to do it based off of how you've explained things and his opinions is he's probably going to make me go geneticist first, rule out the other types, and then by default it'll be HEDS. Because she was like, if you have any other one, then you just have classical, but she was like, I feel like it's HEDS. Because the hypermobility component is there. But technically all connective tissue disorders can make you hypermobile in some way. It's just, if it's hypermobility dominant, it's HEDS. But yeah, so those are the updates I have. So I will let y'all know how Monday goes, because I am going to write that list out. I'm going to bring in the Ehlers-Danlos paper as well, because me and her went over that today too. We didn't print it out, we just went over what's on it, because we both remembered what's on it. And I'm going to self-assess on there with what she told me, and see what he thinks. But yeah, we're learning a lot. And my hip hurts, and my ankle, and my shoulder. Hi, besties. So, I was right. I do have Ehlers-Danlos syndrome. I am going to do an immediate disclaimer. I will not be confidently saying which type I have as of right now. Because my doctor actually referred me to UNC, the University of North Carolina, to be seen by a rheumatologist there. to get it all sorted because we really don't have access to good rheumatologists where I'm at by base. And the last time I got referred to one over here, which was a year ago, the place just wouldn't return my doctor's calls or mine. And so he was like, I want you properly seen by like people that I know will actually help you out. And so I want you to go to UNC. He feels it is the hypermobile type of Ehlers-Danlos, but obviously I need to be properly seen to determine that. But he said that he can confidently say it is Ehlers-Danlos. So that's how we're going to explain it for now. I won't be going to UNC probably until 2025 at the beginning of the year, because it does take a minute to get in. We got to get TRICARE to approve it and all that jazz. But I want to talk about it a little bit and how I went about this appointment. Right. So if y'all saw the previous 2 videos about this topic where I posted about Ehlers-Danlos, my physical therapist saw that I'm having frequent dislocations and she was like, hey girl, like you seem hypermobile, blah, blah, blah. I want to talk to you about this, right? Well, she referred me over to the Ehlers-Danlos website, which I've actually looked at this paper before, 2 years ago when we suspected I had EDS. Like I've had 2 different primaries think I have it, but we didn't have the resources to get me seen by anybody that could actually diagnose it. And I didn't know that you could just give this paper to a doctor. So this time I went in with the actual paper. And I circled, I want to do this in a way where I don't show my info. There we go. I circled, like, for this part, like, it shows all the positions of the hypermobilities in certain joints, and I said that I went over those with my physical therapist, and I circled which ones I could do, filled out all the questions. So the symptoms that I have for the, I think it's the Beighton scale, I may be wrong in pronouncing that, and I apologize, is I do have the hypermobility in my hands, which is able to, like, my fingers go back, right? You're supposed to do it flat on the table, but, you know, and then I can touch this thumb to my wrist, but not this one. My elbows are hypermobile where this sticks up more. It's supposed to be straight, mine are not. My knees are the most hypermobile thing on me, where they super sit far back. Like, I don't know, this is a unique experience, but I was a choir kid, and they always told us don't lock our knees because you're going to make yourself dizzy and you're going to pass out on the risers while you're singing. I locked my knees all the time because I literally could not lock my knees because of how hypermobile they were. Like, my standing position is my knees are locking and they're extending backward. And then I used to be able to put my hands flat on the floor, like touching your toes, when I was a lot younger. But I have chronic back pain now, so like my body literally won't let me do it. So because of that, my score is a 7 out of 9 because of the one hand that I can't do the thing with, and I can't put my hands flat on the floor anymore. And then there's questions of if you're 1 point below your age, which for my age cutoff, I need to be able to do 5. There's questions. I want to bring them up because I qualify for all of the questions on this part. Can you now or could you ever place your hands flat on the floor? Yep. Can you now or could you ever bend your thumb to touch your forearm? Yep. As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? I could not do the splits. However, I used to contort my body in all different shapes all the time, and I thought it was funny. As a child or as a teenager, did your shoulder or kneecap dislocate more than one occasion? My shoulder did, and then I just wrote out more, even though it's not what the question's asking, but just to have more things to explain to him. My middle finger, I broke my middle finger from a dislocation. It got hit with a basketball, went all the way back. And then I've dislocated my ankle a gazillion and a half times. And then, do you consider yourself double jointed? I originally answered that question as no, and then my husband was like, you used to say that to me all the time when we first met, and I was like, oh, okay. And then criteria too. I'm not going to explain all the parts, but I'm going to explain the parts that I have because I understand them because I have them. Unusually soft or velvety skin. I've had multiple doctors say this because the EKG stickies don't stick onto me, they just fall off. And then they're like, you knew to not have lotion for this procedure, blah, 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 nothing sticking. And I'm like, girl, I didn't use shit. I actually have dry skin. But that's an EDS thing. And then mild skin hyperextensibility. I have it in my hands, which is stretching my skin like this. My husband's can't go this far. And I've seen it go even farther than this. I just don't have that symptom as strongly as I've seen other people have it. And then my mom can do it with her skin on her elbows. And then, atrophic scarring, I don't have a spot that I can show you right now, but it's when your scars are indented. And then it explains it way more of like, it has to be in the absence of blah, 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 which mine are. Dental crowding, I did have that. I had braces. I still have like dental crowding on the bottom. All my teeth are squished together. And then I have the positive thumb sign for the Steinberg sign, which is when I make a fist, my thumb sticks out, both hands. So does my mom. The other one is being able to, I know I have sleeves on, but I still can't do it anyway, where you can wrap your hand all the way around your wrist and pinky touch your thumb and overlap. I can't do that part. But that's fine because you need to do one or the other or both. So for that section, I have 6 out of 12. You need 5. And then feature B, which is positive family history. My mom's never been seen for this, but she meets the criteria, so I had her fill this out as well. And she meets all the same criteria as me, but my mom is 61 years old, so the criteria is different for somebody above the age of 50. She only needs to be able to do 4 of the hypermobile things, which she can. It's her elbows and her knees still. She has arthritis in her hands, but just her hands. So she can't do any of the hand ones. But she used to, like, do flips and splits and all that good stuff, so she also could put her hands flat on the floor, and she used to be able to do splits. For criteria 2, we have all the same. However, she's had multiple hernias. It was her 6th thing. And mine, oh, I forgot to say this part. I've had stretch marks since I was a kid, even though I didn't have significant weight gain. She did not have that part, but I did. So she also had 6 for this section. And then her positive family history, we have no idea. So we think maybe my grandpa, just random things he's complained about kind of line up with how me and my mom have functioned, but that's all we got. My grandpa's not alive anymore, so. And then for feature C, so you need either A and B, B and C, A and C. You need 2 of the sections, but I still wanted to include the family history piece, even though me and her both have feature C as well, which is must have at least 1. Both of us have all 3. Musculoskeletal pain in 2 or more limbs reoccurring daily for at least 3 months. We both have that. Chronic widespread pain for at least 3 months, and then recurrent joint dislocations or frank instability, which me and her both have frank instability, which is just how I, like, roll my ankle all the time and stuff. So I went in with those, brought those up to him, explained what my physical therapist said as well, and he was like, yeah, it absolutely sounds like you have Ehlers-Danlos, and it does really sound like you have the hypermobile type, but I want you to go to UNC. So I got a referral to UNC. Bittersweet, because it's one of those, like, I was right again. So, and then I got, MCAS confirmed, earlier last week as well. So POTS, MCAS, EDS, that's my trifecta that I have. We've thought this for the past 4 years. Like, this is not a shocker to anybody that's been following my medical things. Like, my husband was like, okay, and my therapist was like, yup, that makes sense. Like, but it is like, okay, so I do have a connective tissue disorder that there is no cure for, and that's a really, like, hard part of this, but at least we know, Like, at least we finally know, and so he wants me to go to UNC because they're going to be able to give me a better treatment plan, give me better explanation of what I should be doing in PT, and be able to send that down to my physical therapist here so that I can continue physical therapy with her, and he said he'll keep me in PT as long as I need, so, because it's already helping me so much with my hip, even though, like, yeah, there's no cure for EDS, but I was moving so incorrectly. I was continually injuring myself. So, which these injuries that happened in PT last week was because we didn't know the rest of me was hypermobile. Now we do. So now we know what to do with that as well. But, yeah. Oh, and then criterion 3, I didn't say that at all. You have to have certain stuff ruled out. Like, lupus ruled out, rheumatoid arthritis needs to be ruled out, absence of unusual skin fragility, because that's a different type of EDS. Because this paper is just for HEDS. And then exclusion of other diagnoses that include hypermobility, which me and my mom have all of those things excluded, because those were diagnosable things when she was going to doctors for this shit. This criteria was created in 2017. So, I started showing signs of this when I was born in 2003, and my mom was born in 1961, so. But yeah, my mom's 63. I think I said earlier she's 61. She's 63. But yeah, so guess I'm going to UNC. Hi, bestie. Very, very small little chronic illness haul today, actually. I had PT this morning and then ran to Harris Teeter and CVS, and I bought just a couple things and just wanted to make y'all aware of a couple things as well. So I bought, these are at Harris Teeter, but I've seen them on Amazon. I just bought them at Harris Teeter because then I was like, well, if they don't work for me, I can very easily return them, versus Amazon is more of a thing for me. but I like them and I have them on right now. So these are the copper compression fingerless compression gloves, and they were $20. I have some cheapy ones that were like $9, and I do like them, but I like this material more, and they're a lot more comfortable than the ones that I have been using. I'm also intrigued by this grippy. I think I'm still going to use my other ones when I crochet. I think this might be a problem with my yarn, but maybe not. But wearing these to like type and stuff actually has been really nice. So I got myself these today. And then the other thing that I found at CVS, I didn't know, they have their own brand of KT tape. And this was $10 when KT tape usually runs between like $15 and $25. And they also make a super strong version, which I'm assuming I can't use because I'm allergic to adhesive, but we're still going to try it anyway because as long as I don't touch the adhesive, I do fine. So we'll see. It's once friction gets added to the adhesive is when I have a problem. So I'm still going to try it. And they make, KT tape makes a sensitive skin one as well that I've seen other brands do on Amazon that's cheaper. But CVS does not do a version of that, or at least I didn't see it. But yeah, I got a thing of this as well to try. And these are the 20 elastic pre-cut strips. But yeah, I got this to try, and I got it in black so that it matches my vibe. Because I did see another creator on here do a video of how they did their KT tape to help with hypermobility in their fingers, and I want to try it because there's a certain way to wrap it so that it's not letting you do stuff like this. And that sounds lovely. And then the other thing that I want to make y'all aware of is at CVS when I was walking around. I don't know if this is at every CVS, but it's just something to peek for. They had a bunch of mobility aids on clearance at mine in random colors. I'm assuming it's the ones that sat. So, like, they're like collapsible canes and stuff are usually $30. They had them for $14.99 in certain colorways and stuff. So if you've been on the fence about getting a mobility aid and the price was a hurdle for you, my CVS had them on clearance, so keep an eye out, because I know everywhere's clearance is different, but if they're doing it based off of if they sat for a while, that would mean that there's a good chance that other CVS's scanner is picking that up as a clearance that needs to happen. I used to work retail, so keep that in mind. But yeah, just got myself a couple little things today to try to make my life easier, because I deserve to be comfortable. And I thought I would show y'all because the prices were not horrible. This is all a little steep, but these can go on sale on Amazon. But again, I wanted to be able to just get them and return them if I needed to. But I like them, so. Anyway, love y'all. Hi, besties. I apologize if you can hear my AC and my cat eating. But that's it. That's all the background sounds. I want to tell y'all about my cardiology appointment yesterday. I recorded this video once and I didn't like how it turned out, so we're trying again. Which also means I need to mute my phone right now. Okay, that was part of why I didn't like the video, is because my phone went off during it. So, I saw my cardiologist, about my chest pain and the flares that I've been having, because my flares have just, like, been coming on very suddenly now. Before they were very, very predictable, and, like, I could feel them coming on and I had time to, like, sit down, or if I'm driving to pull over, or whatever. And lately, I just tank. Like, like, you know, the audio is like, you have 30 minutes. I have 30 seconds to quick decision what I'm going to do, because I'm going to either pass out, fall, or throw up. So, because it'll just hit, I'll go from fine to, I'll begin to get tachycardic, but I won't be tachycardic at first. I'll have all the symptoms first. And I'll get really sweaty and really clammy and really nauseous and super shaky, and like, it's like a whole thing. And I was telling my cardiologist about like when it would happen and like what things I was doing when it was happening. And the common denominator is physical exertion. So I was walking around downtown and it happened. I had just done a really long day, going to like 2 appointments in the same day that were very far from each other, and it happened. Going to PT, it's been happening on a constant. And she was like, okay, I'm starting to see a theme. And then I was showing her my blood pooling and everything, because I have pictures. I can actually, I'll put in a picture right here of what it looks like. There's going to be a handprint on my arm in these pictures. It was to show the difference, because blood pooling, you can do that. That's like a tell. If you get blood pooling on your legs, you know you can poke it and then it'll make your skin white in it. Yes. That's why it looks like that. I didn't just develop a handprint. And I was telling her that, and then about my chest pain being on the side and kind of like wrapping up and over and just all that stuff. And she was like, okay, I think I have thoughts. I'm gonna go talk to Doc and I'll be right back, because she's the PA under the main guy, Dr. Okorafor. So she went and talked to him and came back, and she's like, okay, it is what I think. Your blood pressure's tanking. And because on Nabivolol, which we love her, it fixed my heart rate right up, but it does make my baseline blood pressure ever so slightly low. Not like dangerously low. I'm still like above 90/60 or at 90/60, which you don't want to go below that, generally speaking. And they kept being like, well, if you're low but you're not symptomatic from it, then your body is okay with that, right? We didn't realize I was symptomatic from it. If it suddenly does it. And my blood pressure, especially like, oh, and the other thing is in the evenings after I had a long ass day is also when it's happening, and my blood pressure will be like 80 over like 55, which is still not horrible, but it's still below 90/60. And I feel when that happens, and then I just like chug a Gatorade and I can get it back up, and then, you know, like I'm fine. But like, yeah, that's been a thing for me. And so she was like, okay, so because your baseline is fairly low, and then when you're doing physical exertion, your body actually tries to lower your blood pressure to compensate for what you're doing. Like that's why they tell people with high blood pressure to exercise. So, it's making it just drop. And then because it's tanking, my body's response to the tank is to make me go tachycardic to try to get it back up. Which is why I'm having breakthrough tachycardia and heart palpitations. It all makes perfect sense. So I got prescribed Midodrin. I may be pronouncing that wrong and I apologize, but it's a medication that will lower heart rate and raise blood pressure. We're trying it in conjunction with my Nabivolol because I am on the lowest dose of Nabivolol, so she thinks that'll be perfectly fine, and we're starting with the lowest dose of Midodrin as well. But I went and picked up today. I'm going to start it tonight. I wanted to start it this morning, and they told me it would be ready at 2:30 yesterday, and then it was not ready until 7:40, 20 minutes before they closed. And I can't drive at night right now, so I was like, great. And in case you're unaware, if you call CVS now, the only way to talk to somebody is to leave a voicemail and rely on them calling you back. So I called them to let them know, like, hey, it's 5 o'clock. I was wondering if you guys could tell me when that's going to be ready, or at 4:30. Because the sun sets at 5 o'clock, I can't drive at night, but I was hoping to pick it up today so I could start the medication in the morning. Blah, blah, blah. Never called me back. Never did. So, it is what it is. And then it was ready at 7:40, so, but yeah. And they had no issues getting me on that one, so we went through pre-authorization to hell with TRICARE to get me on the Nabivolol, but this one, they just covered it right away, so I don't know what's different between the two. I know that, like, Nabivolol is not first line. That might have been why, but I did try metoprolol. Metoprolol, oh my god, it was messing up everything. So, yeah, we're gonna trial Midodrin. And there also might be the possibility where if, like, the Midodrin in combination with the Nabivolol is too much, then we might just do Midodrin. Which I have a friend with POTS that's on just Midodrin. So, we'll see. We'll see. But I'm very excited because when I've been telling them about these symptoms for, like, the past, I don't know, like, 6 months, they kind of just kept being like, huh, that's weird. Well, talk to neurology and allergy and then circle back. And they both were like, yeah, we don't know. Because we thought maybe the blood pooling was an allergy reaction. It's not. I might be having a histamine dump along with things, but it could be because of what my heart's doing. And then neurology was like, don't go on treadmills. That was his answer. I don't go on treadmills. So I don't know how that was the solution. And then he was like, well, you increased fluids and salt, right? And I was like, yes. A lot. I have like 6,000 milligrams of salt a day. Or micrograms? Milligrams. Yeah, milligrams. So I was like, I don't know what else you want me to do. Because I've seen people go up to 10K. But like, if I do that, I'm going to throw it up. So I don't, like, I don't know. And also when the stuff was happening, it was hitting a point where when I would go to the hospital for an emergency infusion, it wouldn't work. So, and we're also realizing that my blood sugar will tank too when this happens. They're all together. So we'll see. But yeah, it was a very positive appointment. I felt very heard and listened to, and they finally gave me more options because I knew mitoderm was an option. I knew I had more options. I knew I ran out of options within the beta blocker scope, but not in the other options. And I know there's a medication, can't remember which one it is because I have so many medications names spinning around in here from talking to people. But there is one that makes your body hold on to the salt and it forces you to. But it is technically a steroid, and I don't want to try that yet because my fear is then, you know, your body can get used to steroids. So my fear is if I utilize it now, then when I'm old and like can't push fluids anymore, I just wasted my chance to be able to utilize that medication, if that makes sense. So I don't want to jump to that one unless I have to because I am able to push fluids. I could be doing so much better than I do. I do good. So I drink the right amount of fluids that I'm supposed to. However, not every bottle of water I have has electrolytes in it. And I could be putting it in everything, and I'm not. So I haven't exhausted that for myself yet, which is why I didn't want to go that route. But they didn't even offer that. But that's just something I knew I could ask about. But yay! So we have another option. I'm cautiously optimistic. Also, midodrin's not like a super side effecty medicine. Like my nebivolol's worse, so I don't have any side effects from nebivolol. But that list was a list compared to the midodrin, so cautiously optimistic. I also found out because I always fact check like my medicine interactions myself because half of my doctors don't catch them, and it's happened before. And so I was checking them all, and I didn't realize that when I got put on the Zoloft that I didn't sit and do that. And I asked every single doctor that I see if the Zoloft was fine with my nebivolol, and they all said yes. And then that's a big moderate reaction, like blaring on the screen, and it says that it can cause like shortness of breath and chest pain and all this stuff, and you're supposed to tell them. And I don't know where my chest pain is coming from, but I feel I've been having this before I went on the Zoloft, so this started before, and then they put me on the Zoloft to help me with it. And the Zoloft's been helping a lot of my, like, fatigue. Like, my chronic fatigue is pretty mellowed out with me on Zoloft. So, yeah, I don't want to go off it. So I really hope that's not part of this problem. But yeah. My cardiologist, too, was like, no, I'm fine with you on Zoloft. I'm happy with you on Zoloft. And I know a lot of Potsies that are on it. So I think it's just one of those, like, watch for that effect. And if it doesn't happen, it's fine. Because I think that's why it's a moderate reaction and not an automatic no. But, like, shit. So we'll see. We shall see. But that's the only one that comes up now when I look up all my stuff. So the rest are fine. And the midodrin doesn't interact with anything I'm on. So I just can't take Zantac anymore, which is fine. I haven't in years. But now I just know for sure I can't anymore. But yeah, good appointment. Yay!